Colorectal cancer is a disease that begins in the large intestine, which includes the colon and the rectum. This part of your body is the final stop in the digestive system. Its main job is to absorb water and electrolytes from food that has been digested and then pass waste from the body. When cells in the lining of the colon or rectum begin to grow out of control, they can form tumors. Not all of these growths are cancerous. Some are benign polyps, but over time some polyps can develop into cancer. This is why regular screenings, like colonoscopies, are so important for early detection and prevention. This type of cancer is one of the most common cancers diagnosed worldwide. It affects both men and women, and the risk often increases with age. While the exact cause isn't always known, several factors can raise your risk. These include media group, family looking at family medical history records, doctor discussing genetic risk factors with patient, at stock at distribute _equally, a family history of the disease, certain genetic syndrome, and lifestyle choices, things like media group, person eating steak and processed meats, unhealthy meal with low fiber foods on table at stock, at distribute _equally, a diet low in fiber and high in red or processed meats, a lack of regular physical activity, obesity, and smoking can all contribute to a higher risk. Understanding these risk factors is the first step in empowering ourselves to take preventive measures and make healthier choices. The journey for someone diagnosed with colorectal cancer can be long and challenging. Treatment often involves a combination of media group, surgical team in operating room, patient receiving chemotherapy, doctor preparing for radiation therapy, at stock at distribute _equally, surgery to remove the tumor, chemotherapy, and radiation therapy. While these treatments can be very effective, one of the biggest fears for survivors is the possibility of the cancer returning, what we call recurrence. Doctors and patients are always looking for ways to reduce this risk. Finding a safe, effective, and accessible method to prevent recurrence could change the lives of millions of people who have battled this disease and are now living in its shadow, hoping for a future free from cancer. This constant search for better outcomes is what drives medical research forward. Scientists are continually exploring new strategies and even looking at old familiar medicines in a new light. They want to find something that can give survivors a better chance at a long and healthy life after their initial treatment is complete. It's a mission fueled by the stories of patients and their families. This brings us to a familiar name you might find in your own medicine cabinet. A simple pill that has been around for over a century and is now showing remarkable promise in this ongoing fight against a formidable disease. In the world of medicine, sometimes the most profound discoveries come from unexpected places. Recently, a significant study has brought a common over-the-counter medication into the spotlight for its potential role in fighting cancer. Researchers have been investigating whether taking a low dose of aspirin each day could help prevent colorectal cancer from coming back after treatment. This is a big deal. For patients who have already gone through the difficult process of surgery and chemotherapy, the idea that a simple, inexpensive pill could help keep them cancer-free is a powerful source of hope. The study, a comprehensive analysis of several previous clinical trials, was designed to look at a very specific question. Scientists wanted to see if there was a link between regular aspirin use and the risk of cancer recurrence and survival in patients who had already been treated for colorectal cancer. They gathered data from thousands of patients, carefully examining their medical histories, their treatments, and whether or not they took aspirin after their diagnosis. This type of large-scale analysis, called a meta-analysis, is powerful because it combines the results of many studies to find a more reliable and stronger conclusion than any single study could provide on its own. The findings from this extensive research were striking and offered a significant glimmer of hope. The data showed that patients who regularly took low-dose aspirin after their treatment for colorectal cancer had a lower risk of the cancer returning compared to those who did not take aspirin. More than that, the study also suggested that these patients had a better overall survival rate. This means that not only was the cancer less likely to come back, but the patients were also more likely to live longer. This is exactly the kind of outcome that both doctors and patients are hoping for. It is important to understand what low-dose aspirin means in this context. We are not talking about the higher doses you might take for a headache. The studies typically looked at a daily dose of around 81 milligrams, often called baby aspirin, which is the same dose many people already take to help prevent heart attacks and strokes. The fact that such a small amount of a common medication could have such a significant impact on a serious disease like cancer is what makes these findings so compelling and worthy of our attention as we continue to explore every possible avenue to improve patient care. You might be wondering how a simple pain reliever could possibly fight something as complex as cancer. The answer likely lies in aspirin's primary mechanism of action, reducing inflammation. We know that chronic inflammation can create an environment in the body where cancer cells can thrive and grow. Aspirin works by blocking enzymes called COX enzymes, particularly COX-2, which are key players in the inflammatory process. By tamping down this inflammation, aspirin may help make the area around a former tumor less hospitable for any lingering cancer cells that might be trying to make a comeback. Another way aspirin might be working is by affecting platelets, the tiny cells in our blood that help it clot. Cancer cells can sometimes use platelets to their advantage, hiding within clusters of them to travel through the bloodstream and establish new tumors in other parts of the body, a process called metastasis. Aspirin is well known for its antiplatelet effects. It makes them less sticky. By interfering with the platelets' ability to clump together, aspirin might make it much harder for cancer cells to spread, effectively cutting off their escape route and keeping the cancer contained. Furthermore, some research suggests that aspirin may have a more direct effect on cancer cells themselves. It appears to be able to trigger a process called apoptosis, which is essentially programmed cell death. Healthy cells have a natural life cycle and die off when they are supposed to. But cancer cells are notorious for avoiding this process and living indefinitely. Aspirin might help restore this natural order by sending signals to the cancer cells that it's time to die, helping to eliminate them before they can form a new tumor and cause a recurrence of the disease. What makes this research so exciting is that aspirin is a medication we already know so much about. It is one of the most widely used drugs in the world. It is incredibly inexpensive and it is readily available. For decades, it has been a cornerstone for preventing cardiovascular disease like heart attacks and strokes in at-risk patients. The idea that this same affordable pill could be repurposed to also help cancer survivors is a game changer. It represents a potentially low-cost, high-impact tool that could be used globally to improve outcomes for countless individuals who have faced a colorectal cancer diagnosis. While these findings are incredibly promising, it is crucial to approach them with a sense of cautious optimism. It is not yet time for every colorectal cancer survivor to start taking aspirin. The research we have now is a major step forward, but more studies are needed to confirm these benefits and to figure out exactly who is most likely to be helped by this therapy. We need to identify the optimal dose and the ideal duration of treatment. Future research will likely focus on large, randomized, controlled trials specifically designed to answer these important questions with a higher degree of certainty. We also have to talk about the risks. Aspirin is a real medicine with real side effects, and it is not right for everyone. The most well-known risk associated with long-term aspirin use is an increased chance of bleeding, particularly in the stomach and digestive tract. For some people, this risk might outweigh the potential benefits. This is why it is absolutely essential that you do not start taking aspirin on your own. Any decision about starting a new medication, even one that is available over the counter, should be made in consultation with your doctor, who can weigh your personal health history and risk factors. The journey from a promising study to a standard medical guideline is a long one, but this research provides a clear and hopeful direction. It empowers doctors with new information and gives patients a reason to have an important conversation with their healthcare team. This is about personalized medicine, finding the right strategy for the right patient. For some colorectal cancer survivors, a daily low-dose aspirin could one day become a standard part of their follow-up care, a simple action they can take to actively reduce their risk of recurrence and take back some control over their health. Ultimately, this news is about more than just a pill, it is about hope. For the millions of people who live with the uncertainty that follows a cancer diagnosis, every new piece of research that points toward a better, longer life is a victory. It shows that the medical community is relentlessly working to turn the tide against this disease. While we wait for more definitive answers, the potential for a common, inexpensive drug like aspirin to make a real difference offers a powerful and optimistic message. We are getting closer to a future where surviving cancer is just the beginning of a long and healthy life.